Nigeria's death toll from Lassa fever has risen to 40 after more infected patients lost the battle to the disease. The Nigerian Center for Disease Control disclosed this in its latest situation report on the management of the outcome of the disease in the country. Data from the report indicates that 6 new deaths were recorded in week 4, covering January 24th to the 30th of the same month. The agency adds that 229 suspected cases were reported from 16 local government areas across 5 states last week, but only 42 of them were confirmed. Well, this brings the total number of infection confirmed since the beginning of the year to 211 out of 981 suspected cases reported from 43 local government areas across 14 states. And a total of 35 new cases of COVID-19 were reported from 5 states and the Federal Capital Territory in the last 24 hours. The Nigerian Center for Disease Control again confirmed this in an update on the outbreak of the disease in the country. And of all the new cases reported on the 4th of February, Rivers State recorded the highest infections with 15 and was followed by Katsina with 8, the FCT 6, while all the states, including Gombe with 4, Ekiti 1, Kano equally had 1 confirmed case of COVID-19. And no new deaths was recorded in the last 24 hours as well. And the Nigerian Center for Disease Control has commended journalists for providing a robust coverage on COVID-19. NCDC Director General Dr. Ifedayo Adetifar described as heroic efforts by journalists to educate Nigerians on the dangers posed by the nation by the virus.
The journalists have been quite important to the work that we do in bringing attention, additional focus, and of course in their work and advocacy on the national health security agenda. And at the NCDC we are particularly pleased because we believe that the work that journalists have done to prevent pandemics has led to increased funding to the Federal Ministry of Health, our parent body, and as well as to the NCDC directly.
This is a pandemic that came with a disease that had no cure. There was no vaccine in the beginning. So everything we did was about social adaptation, our habits, our lifestyle change and all that. And so communication was key, remains key to containing this pandemic.
We know that the Nigerian health system is severely underfunded, and COVID-19 has shown us especially how important it is for us to fund our health security. So throughout the year, we were able to support journalists in training them in holding masterclasses, and we were able to strengthen the capacity to report epidemic preparedness.
And to discuss Nigeria's response and preparedness for epidemics and pandemics, we're now being joined by Vivianne Ihekweazu. She is the Managing Director of the Nigerian Health Watch. Thank you so much, Vivianne, for being here. And of course, first of all, let's talk about, Nigeria's preparedness for not just pandemic, which we're dealing with COVID-19, but epidemics, especially looking at diseases that are supposed to be preventable. How well are we preparing as a nation?
Thank you, Amaka. Good evening, and thank you for inviting me onto this show. In terms of preparedness, what we know in Nigeria is we have so many infectious diseases that we have to continuously respond to. You opened with talking about Lassa fever. Lassa fever, we've had it in Nigeria for over 50 years, and to date we are still battling to respond to it. We have diseases like cholera, which has killed more people than COVID-19 itself. So in terms of responding to epidemics in the country, we know we have a severely underfunded health system, and our health security, in addition to that, is severely underfunded.
Right. So I know that the budgetary allocation, we signed up to that Abuja declaration that we said at least 15%. And I do know that in the last 10 years, we haven't seen up to 10%. So aside from the government funding, really, how else can we prevent the next pandemic, from ravaging us? Yes, we have survived COVID-19 thus far, not as bad as, the world expected. But looking to the future, what more should Nigeria be doing and be putting in place to avoid a catastrophe, just in case one comes tomorrow?
For us to prepare for any future pandemics in Nigeria, we have to remember that prevention is better than cure. So what that means is preparedness at the national and at the subnational level. So the national government has to be prepared, but also the states have to be prepared. And in order for that to happen, it requires epidemic preparedness response funding. It was only, remember, in 2018 that NCDC finally got its mandate in November, when Mr. President signed the bill for an act to establish NCDC. And that enabled it to now have a legal mandate to respond to epidemics across the country. And with that comes the work we've been doing at Nigeria Health Watch, which is strengthening the capacity of media to report and hold government to account and policymakers to account. And what we've seen is the work we've done has enabled media to be strengthened in terms of knowing the facts, getting the data, and communicating to Nigerians the importance of epidemic preparedness and response. And so we know that to be prepared, we need adequate funding at the national, especially at the subnational level, because, you know, as we see with Lassa fever and cholera, infectious diseases start in communities. And so there needs to be preparedness right from the grassroots, from the community, up until the local and then the national government.
All right. You know what? I do know that Nigerian Health Watch, you've actually done a lot. I've been one of, I've been one person who benefited from some of your trainings really to help the media. But what more really can we do as the fourth estate of the realm to ensure that people are educated? Because some of these diseases are preventable if caught on time.
Yes.
What more can the media do?
I think the media plays a critical role, TV, radio, print, social media especially. And the critical role really of the media is to inform Nigerians. You know, as a fourth estate of democracy, you are the voice of Nigerians. So it's your voice is what informs Nigerians what to do to prevent epidemics, and also holding the government to account. So really being that voice between the government and the people, representing their views, ensuring that we communicate. And we saw the critical importance of communication during the COVID-19 pandemic. You guys had your plate full in keeping up with the science, in keeping up with the evolution of the virus. The PTFs, you know, Arise TV and many other stations, you were there every day.
Absolutely.
Asking the policymakers and government important questions that Nigerians were asking. So the media plays a critical role in keeping the public informed and also building trust between the government and the people. And so yesterday, you know, we were celebrating media excellence, celebrating journalists, radio, TV, that responded and reported on epidemic preparedness. And Arise TV was honored as one of the station that, you know, consistently reported on COVID-19. And, you know, we saw your journalists go into treatment centers. You saw your journalists go into labs to actually show Nigerians what was being done and really asking those critical questions. And, you know, you have kept up in your reporting every morning. You know, Adesuwale reporting on the COVID-19 numbers, not just in Nigeria, but globally, because, absolutely, you know, we're not an island. So putting the Nigeria numbers in context with the fact that it's a global pandemic. So, you know, we felt it's important to honor Arise TV because many of the stations have really done a great job. But consistently, you have reported on the need for the country to respond. And so, you know, we honored you last night, and this is a gift.
We definitely...
This is for Arise TV.
We definitely received the award. I will receive
it. And we hope you continue, along with other media stations, the media, print, TV, radio. You know, let's keep the conversation going. Let's build that trust between the people and the government and ensure we inform Nigerians, you're communicating, you're asking those critical questions.
Absolutely.
And holding them accountable.
Thank you so much, Vivianne Ihekweazu, and of course, Nigeria Health Watch. I will receive this. Yes, I know that it was a serious, you know, it was troubling times during the pandemic. Going into the isolation centers with not a lot of information was scary, especially going back home. And my family was scared and worried and asking all those questions every day during the lockdown and going for those briefings. But we appreciate that you see all the hard work and you've given this
Congratulations.
So, thank you so much. Nigeria Health Watch, we appreciate you for appreciating our hard work and well done for all that you do. And by the way, happy birthday in advance to you, Vivianne. Lil Birdie told me it's your birthday tomorrow. So happy birthday to you and thank you for coming again tonight.
You're welcome.